in your career, have you seen anything like this in terms of outside of simulations, I suppose?
Right. No, that's an easy answer, Ryan. Absolutely no. And I can vouch to the audience that there are only 3 of us in here, and we're pretty distant from each other. But no, Brian, these are unprecedented times. Whether you're a physician, whether you're a nurse, whether anybody in the public, and so I think it's a time though that we're all galvanizing. We're coming together in spirit, staying apart, right, physically. But no, it's a time that things are changing day by day. And as we were sort of setting up for this, I was checking my phone, not to be asocial, but because emails and texts are coming in just real time with changes.
Well, and you being the CEO of Metro Health, University of Michigan Health, is, you're quarterbacking this whole thing with a lot of help and experts.
Absolutely.
But just when did Metro Health's radar really go up and start to plan, for our community? Because you're such a big part of keeping everyone here healthy. You're a big hospital system here. And when did you get wind of okay, this has my attention now?
Yeah, I think as a healthcare system, just like our sort of sister organizations here in Grand Rapids, all around the state, we've got great plans around disasters and protocols. In terms of COVID-19, really, I think the alarms for us as healthcare systems were taken off probably in about the last 2 weeks. The world has changed in the last 1 to 2 months, but really, I think locally, probably in the last 2 weeks, really realizing the extent of what could happen, and really just also looking at what's happened in Italy, I think has really informed the way we think about it, informed the way that we plan for this. I do want to speak to just the spirit of collaboration between Spectrum, St. Mary's, and us. I'm in touch with my counterparts there regularly.
Yeah.
And it's great to be working together. But the last 1 to 2 weeks has been really crucial.
Well, I think that's great to hear because in my industry, there's and as healthcare has expanded in our region, we're a growing, thriving economic region. So there's lots of opportunities for growth for healthcare systems. There's kind of a gloves on, time to put the gloves on and time to take them off. And it sounds to me like, now's not the time to, it's a time to come together and pool resources and talent and keep an eye on our neighbors, whether we're sister healthcare systems, as you said, or just partners in the community.
Absolutely. I think there's, I was on a call with Governor Whitmer and other hospital CEOs a few days ago, and we're all facing the same issues really and concerned about the same things. And I think the government has stepped up to make sure that we feel taken care of. But I can't stress enough really from a healthcare perspective how important that term flattening the curve is.
Yes.
Right.
This Full Exposure podcast episode has been made possible through the support of Metro Health, University of Michigan Health, and Dr. Peter Hahn, who believe that creativity and the arts are essential to a rich, healthy, and fulfilling life.